Welcome back. We are going to start today on our series about nutrition and the life cycle. We're going to start with nutrition in pregnancy and go through that. I just thought this was kind of a cool picture. You can see a little foot sticking out there. It's just kind of a cool picture, I thought. Anyway, but before we do, we are going to look at Aunt Linda, a little story from Aunt Linda. Okay, so listen carefully. So it's got some morals to this story. So the teacher gave her fifth grade class an assignment. Get their parents to tell them a story with a moral at the end of it. The next day, the kids came back and one by one began to tell their stories. Ashley said, "My father's a farmer, and we have a lot of egg-laying hens. One time we were taking our eggs to the market in a basket on the front seat of the car when we hit a big bump in the road and all the eggs went flying and broke and made a mess." "What's the moral of the story?" asked the teacher. "Don't put all your eggs in one basket." "Very good," said the teacher. Next, little Sarah raised her hand and said, "Our family are farmers too, but we raise chickens for the meat market. We had a dozen eggs one time, but when they hatched, we only got 10 chicks. And the moral of the story is don't count your chickens before they hatched." That was a fine story. Michael, do you have a story to share? Yes. My daddy told me the story about my Aunt Linda. Aunt Linda was a flight engineer in the Gulf War, and her plane got hit. She had to bail out over enemy territory, and all she had was a bottle of whiskey, a machine gun, and a machete. She drank the whiskey on the way down so it wouldn't break, and then she landed right in the middle of 100 enemy troops. She killed 70 of them with the machine gun until she ran out of bullets. Then she killed 20 more with the machete until the blade broke. And then she killed the last 10 with her bare hands. "Good heavens," said the horrified teacher. "What kind of moral did your daddy tell you from that horrible story?" "Stay away from Aunt Linda when she's drinking," was the moral of Okay, anyway. Let me go through, first of all, the stages of human fetal growth so that we can tie that back in when we get into the nutrition section of this. But as we go through human fetal growth, we'll go, obviously, the first trimester is sometimes referred to as the blastocystic stage, or you might hear it as the pre-embryonic stage, from conception to 2 weeks. And basically, it's just increase in cell numbers. So rapid mitosis occurs in that first 2-week period. So as you can follow it from the right-hand side, you can see here's where fertilization occurs, and we start our mitosis about twice a day as we go up the fallopian tubes and then get into the uterus and get to the blastocyst. So that's sometimes why it's referred to as a blastocystic stage, but it will, after it implants, it will become an embryo, so sometimes referred to as the pre-embryonic stage. Then once implantation occurs, we get to the embryonic stage about the 3rd to the 9th week during the first trimester. And you still have increased number, but you start getting cell differentiation. So this cell decides, I'm going to be the nervous system, I'm going to be the skeletal, I'm going to be the digestive, and so forth and so on. So obviously some pretty important things are happening during that period. And then you can see the embryonic growth here as the baby gets in. So up until you get at the end of the embryonic period, then you basically become a fetus. And so that basically begins the 2nd and 3rd trimesters. And during the fetal stage of development, you'll still continue to have some hyperplasia with your cell organs and stuff. At the fetal stage, you pretty much have all your parts. But what you're going to do is just grow bigger and maybe more cells, but all the parts are pretty much done. Your heart's beating, the nervous system is working, everything is kind of working at the end when you become during the end of the about the 9th week when you get the fetal development. And then you can see fetal growth from here is basically just growing, not developing systems, but just making them bigger. So let's look at knowing that information, let's look at some growth failures that can occur during the different stages. But I want to introduce you to something that's not in your book. I got this from another text from a university professor at the University of Washington, Bonnie Worthington Roberts, who's probably one of the leading experts in pregnancy and lactation and that kind of thing. So if you have any more interest, you might look up a book by her. Bonnie Worthington Roberts is her name. Anyway, she goes through and introduces two types of growth failure. One's called intrinsic intrauterine, which basically means that the placenta doesn't get changed, but things that cross the placenta and get to the growing baby would then affect its growth. And so, things like viruses with chicken pox, things like chromosomal abnormalities when you get the third 21st chromosome and that kind of thing would be nothing to do with the placenta. And then alcohol and drugs and things that can get right through the placenta to the baby would be intrinsic intrauterine. And basically this is what would cause some pretty severe growth failure, missing digits possibly, mental impairment, that kind of thing. And it could be a result of that. Our main concern in nutrition, though, is extrinsic. I mean, intrinsic, I could go back. Intrinsic would be, possibly could occur if you have overdoses of like fat-soluble vitamins. If you're mega dosing on vitamins, then maybe they could become a drug almost. So that could be a possibility. But normally in nutrition we look at the extrinsic intrauterine, where you do have things that will reduce the placenta size and function. And so you reduce the amount of nutrition that the baby's going to get if the placenta is affected. And so what can happen there is not necessarily so much malformations like missing digits or something like that, but reduce cell number, reduce cell size, so lack of growth, and something they call asymmetric body retardation. We'll talk a little bit about that. So from now on, basically what we will be talking about the rest of this lecture will be extrinsic intrauterine as opposed to intrinsic kind of things, because this is what nutrition deals with mostly. But you can see here's some intrauterine growth retardation issues. And so alcohol use and different things like that would cause that. But so there's several things that can be considered intrauterine. It just depends if they're intrinsic or extrinsic. This next slide I always thought was kind of interesting, because this lady's worried about the jackhammers and yet she's smoking. So I mean, she should be less worried about the jackhammers and more about the smoking issue. Anyway, so let's look at extrinsic intrauterine. There's three things that determine how severe the complications will be. Number one is the timing. I mean, when did it happen during the pregnancy? Did it happen during the first trimester, second trimester, or third trimester? When you had severe undernutrition, say, when did that occur? Because it's going to be more important if it happened during the first trimester, when differentiation occurs and that kind of thing, and you're trying to determine the parts and stuff, then that's going to be more significant than if it happened in the third trimester. Duration, how long? Was it 2 weeks? Was it a month? Was it the whole pregnancy? Was it just one trimester? That kind of thing, when you just didn't have enough money to buy food or something happened. How long was the malnutrition? And then how severe was it? Did you get 50% of what you needed? Did you get 75% of what you needed? Did you get or were you basically missing a specific nutrient? Did you not get any calcium because you didn't have money to buy milk or get something with calcium in it? Did you not get enough protein just because you couldn't purchase the foods or have those available that were important? So it just depends, because malnutrition could be just one nutrient, if you remember. That kind of a thing. So I need you to remember those three things: that when it happened, how long did it occur, and how severe was it. So remember those three things. Just kind of a hint. So if it happens during the first trimester, a miscarriage is the most common problem. If your body does not feel it can carry this pregnancy to term, then it will cause a miscarriage with that. It always makes me wonder, though, because if you don't get adequate nutrition, a lot of miscarriages happen in this country, but you notice in countries that are starving, they tend to have a lot of pregnancies and a lot of kids. So there is that idea your body can compensate if necessary. If you're used to that level, your body can compensate and overcome that. Lack of cell differentiation, again, we know that vitamin A is very important for cell differentiation. If you're limited in vitamin A, that can affect how effective the nervous system is put together, or the digestive system, or the circulatory system, something like that. And then one of the main things is a lot of brain development occurring. Could you impair the development of the brain during the first trimester? Second, third trimesters, again, by the time you get to the second trimester, basically all the body parts are made. You have your systems made. They're just going to get bigger. So we're more interested in the second, third trimesters of malnutrition is the growth of the organs. So small for gestational age, so it may be causing premature birth, that kind of thing, or what we just meant asymmetric body retardation. And this is just one example where you'd maybe have normal brain size, normal head circumference, but reduced liver size, 50% of the normal size of the liver, no glycogen stores, that kind of thing to maintain sugar levels, and hypoglycemia, those kind of things, which makes sense with the glycogen stores. But there are some other asymmetric deals. I just wanted to introduce you to one where there's just not normal. And then brain development, again, can be an issue with that. So let's look at preconception. Let's look at nutrition recommendations for preconception. Is that if you are overweight and obese, then these are the possible complications that could occur during pregnancy. So I don't need to read them to you, but it can cause some problems. So there's some problems with being overweight. So the recommendation, try to achieve and maintain a healthy weight. If you're underweight, that can also be a problem. Small for gestational age births, premature births, extrinsic growth failure, low APGAR scores, all of those. So if you're really, really underweight, the recommendation is try to achieve a healthy weight and give your new baby a chance. I mean, this is nice to say, but I know there's lots of surprises during pregnancies. You weren't thinking about getting pregnant, but it just occurs. It just happens. And so yes, one of the main concerns, I guess, from a nutrition perspective, especially with teenage pregnancies, is you don't know you're pregnant for, whatever, maybe a month, kind of a thing. And so you don't eat well for the first month. Well, that's basically, 4 weeks of the first trimester when, things are really developing and stuff. So how does that affect the outcome of the pregnancy? How does that affect the baby? I don't know that anybody really knows for sure, because it can affect, baby different ways, but we know it can have an effect if we know that this is occurring. So anyway, if you can, you want to pre-plan your pregnancy and then achieve healthy body weight. Some people don't know what APGAR score is, but when their baby is first born, they will check and give it a score based on these criteria: muscle tone, skin color, pulse, those kinds of things, and they give it an APGAR score to determine how well it's doing. Folic acid is a key one, and that's why it's very important nutritionally before pregnancy to get folic acid. Neural tube defects, red blood cell production, Folic acid and B12 work together for making new cells for basically for structure of DNA and RNA and that kind of thing. So it's very critical to have that going before you actually get pregnant, because it's going to happen very rapidly once fertilization occurs. What's a neural tube defect? Basically, you can see it's an outcropping here of the spinal cord, and this would be an example of that. So folic acid can help with that. Again, preconception, alcohol. If you can stop drinking alcohol and limit caffeine before you get pregnant, again, the better. Because again, you may not know you're pregnant for a month, and so alcohol during that very important critical time of differentiation can be could be a limiting factor, especially for brain development and things like that. And teratogenic effects, basically, there's lots of possibilities. You can see here alcohol, drugs, all of these can interfere with the proper growth of the fetus and the embryo. So teratogens, even medications that you take. So this is very critical that your physician knows what medications you're taking and different things like that. Again, if you can plan your pregnancy, the better. If you can't, then you take your chances. I guess I don't know what else to say. And then this chart just basically shows during what weeks would teratogens have the most effect on what part of your body. So the palate and stuff, is a little bit later, externally, a little bit later, but, the central nervous system, CNS here, right from the get-go. So it can affect, depending on when you have those drugs or whatever, can have an effect on the part of the body. Energy requirements. Okay, now we're into pregnancy. So those were all pre-pregnancy, preconception recommendations. Pregnancy, basically the first trimester, you're just increasing cell number, not cell size. So it's during the second, third trimesters when you're going to increase your calorie intake. But you're not eating for two. It's only 200 to 300 calories. So that's 2 glasses of milk or something like that, because you are going to increase basal metabolism, and there's going to be lots of things going on as far as growth is concerned. So basically the first trimester is quality of nutrients. The second, third trimesters is quality plus quantity. So it's very critical that first trimester to get the adequate quality of nutrients, very important during that period, as opposed to getting enough, eating for two or something like that. Protein, again, it goes up because with all the things that are happening with growth of the baby and that kind of thing, we're going to need more protein to make sure we have enough amino acids for enzymes and all that cell division and all that kind of thing that's going on. Iron, one of the main things about iron is during pregnancy a lot of women are anemic. I mean, a lot of women are anemic anyway, iron deficiency anemia, even before pregnancy. And so it's critical to get that iron level up, because if the mother is going to keep, mother's body is going to try to keep the mother alive as opposed to the baby, and so if iron is limited, the baby's not going to get enough iron for that, and so it's going to be increased or decreased hemoglobin production for the mother and for the baby. Possibly, there's some stress going on, cardiac stress and fetal storage. When we get into a little bit about feeding the baby, we'll talk about milk. And if you look at milk, there's very little iron in milk, and milk is very deficient in iron. And so the baby will store iron in its liver to live off them the first 6 months to a year. If you don't have adequate iron, then it's not going to store enough in the liver, and so that could be a problem after it's born. And just giving it milk, which again is one of the recommendations, that just to make sure that physicians will sometimes ask the mothers to give supplements to the baby, or especially if you're not nursing but you're bottle feeding with a formula, make sure you get an iron fortified formula, that kind of thing. And but even if you're nursing, they might recommend, just in case they didn't get enough iron during pregnancy, that you give supplements of iron to the baby, because it's very critical. Calcium, again, lots of skeletal growth and teeth and those kinds of things are growing, or they're starting the beginning of formation of teeth, and getting them established, the nubs, if you will, kind of thing. Especially during the second, third trimesters. Again, the first trimester you're just getting organized, and then the skeletal system is going to start growing. So it's really critical in the second and third trimesters. Not a ton more, but you just need to make sure you get your 1,200 milligrams. Again, we've talked about folic acid, neural tube defects, megaloblastic anemia basically just means immature red blood cells if you don't have enough folic acid. And they'll get really big and sometimes have a nucleus because they're immature, kind of a thing. Red blood cells normally don't have a nucleus. So anyway, vitamin D, again, bones, very critical. We talked about this in osteoporosis, very critical for the growing skeleton. Make sure we're getting enough vitamin D. So obviously the prenatal vitamins are going to be critical because they're going to have all these in there. But just make sure you're getting quality food. Alcohol, again, fetal alcohol syndrome is an issue during pregnancy. Here's an example of fetal alcohol syndrome and some of the symptoms of what you would see with fetal alcohol syndrome. But always amazed me. I was a nutritionist in a low-income clinic when I first got out of college, and as you might imagine, I was going to save the world. And so my job at this low-income clinic was that the physicians would send the patients to me if they felt they needed a nutrition consult. And one time I had a patient come in who was pregnant, and so I was giving her my spiel, and I had all the little flyers and all this stuff about how you should eat and blah blah blah. And I thought I was on a roll. I thought I had her on the edge of my seat, and she stopped me basically mid-sentence and said, "You know, really the only thing I want to know is how many beers can I drink and it won't affect my baby." And obviously I was stunned. I mean, it took the wind right out of my sail, and I was. But luckily I reestablished myself, and I basically told her that what we know is if you don't drink alcohol, there will be no fetal alcohol syndrome. If you drink too much, you have a very high risk of fetal alcohol syndrome in your baby. Where in between that line is, nobody knows. I mean, there's been lots of animal studies. Possibility you could get away with drinking a glass of wine, that may not affect, but who knows? So nobody has a clue how much alcohol is going to affect your particular situation and your particular baby. So if you can do without alcohol for 9 months, well, actually, if you're going to nurse your baby longer than that, because alcohol will get into your bloodstream, it gets into the milk, and you can actually your baby will get alcohol. So if you can do without alcohol for a while, I mean, give your baby the best start possible. So anyway, but who knows? I mean, if you have to drink wine, if you have to drink alcohol, I don't know why anybody would have to, but talk to your physician and get whatever their opinion is. But your goal is to give your baby the best start possible, and if you can do without things for 9 months, the better for your baby. Here's some complications. Pyka basically means you eat strange stuff, chalk, dirt, coffee grounds. It's beyond pickles and ice cream. It's paint chips, those kinds of things, for whatever reason, and they believe it's a hormonal issue. that causes sometimes women to eat strange things. But the problem is that, again, if you're eating paint chips, lead paint poisoning, anemia, the one being things you fill up on junk, it eats even more than junk, and you don't feel hungry to eat good food. So Pyka is not a good thing. This might be Pyka, just a little boy with Pyka. Anyway. Nausea and vomiting, again, the hormonal changes causes an increased sense of smell that's just overwhelming. What is the recommendation possibly for overcoming nausea and vomiting? I mean, it's just going to occur in the morning. Morning sickness and that kind of thing is just going to occur, but some of the things that seem to aggravate it are large meals during the day, especially though high fatty, greasy foods late at night. It tend to lead to morning sickness more in the morning. So if you can avoid high fat, greasy foods, which you should do anyway, and maybe eat, like a diabetic, 6 to 8 little meals a day instead of one big meal, then that can help. But for some people, it's just going to happen. That's just the way it is. Constipation, that's because, again, you've got a lot of pressure from the baby on your intestines. It's kind of squeezing the intestines a little bit. And so, there's just some hormonal issues that are causing the relaxing of GI muscles, so it's not pushing the food through. What are some recommendations? Obviously, high fluids to make sure that the waste material is not like packed kind of thing. Insoluble fiber, dried fruits. Prunes do have a chemical that draws water in. And then maintain your activity. If you're sitting down a lot, crunching everything together, that doesn't help. But if you can get up and walk around and get things, possibly open up some space there for things to happen. Heartburn, again, it's getting, the baby's pushing up on the stomach, plus hormonal changes can sometimes relax the cardiac sphincter, or the lower esophageal sphincter, and open it up so it relaxes a little bit. And so again, not eating a lot of food that can put more pressure up, or acid producing foods like pepper or chilies, or foods that would increase hydrochloric acid. Your physician can give you a list of things that would do that. Coffee, caffeine can increase acid, hydrochloric acid production. So, and then laying down on your back sometimes it gives it limits. So you might want to elevate your upper body, kind of things. Pregnancy-induced hypertension. This is, again, hormonal changes, a lot during the third trimester. This would be something the doctor is really dialed in on, because if it gets to the point where you're pre-eclampsia, then they're going to really watch it very, very closely. And if you get to the eclampsia change, basically they will have you bedridden. They may even do it in the pre-eclampsia stage. Usually happens in the third trimester, where they basically say, okay, for the next month, you basically are going to be you're going to be bedridden, kind of a thing. Anyway, we'll look at some of the progression of when they would come to eclampsia, but getting adequate protein seems to be an issue, and then adequate calcium seems to be an issue. But there was a study called the Burke study done several years ago at, I believe it's the Harvard School of Public Health, and they basically looked at the diets of women, and they found that women that were missing one food group, then they had the highest percentage of eclampsia or preeclampsia, that kind of thing. And then women who had a fair diet then was lower percent, but still a high incidence of preeclampsia. And then women who had a good diet, good healthy diet, had no incidences of preeclampsia. So again, that goes back to preconception and conception, kind of an issue, because it kind of follows each other. But some of the, if you're looking at specific nutrients, make sure you get adequate protein, adequate calcium seems to be an issue. But let's look at this trend here. Basically, again, they're going to monitor blood pressure, and then there's either a yes or no at 20 weeks, whether you have high blood pressure or not. If you don't, then you go down here, and they continue looking at proteinuria, whether you have it or not. That would be protein in your urine. If you do have high blood pressure, then they go down this progression. Again, it could be just gestational hypertension, but if you have proteinuria, then basically they would go to the next step and monitor very closely your level, your blood pressure, and your levels of protein in the urine. And if you continue to have it, you're going to either have preeclampsia or severe preeclampsia, and then if you start having seizures, you'd have then eclampsia. So there is a progression they look at, starting with blood pressure. So be prepared. If you get pregnant and your blood pressure is high, they may really want to monitor you over that time. Weight gain, basically weight gain is kind of a touchy subject, because I know my wife gained a lot of weight during the first pregnancy. Don't tell her, but upwards of 50 pounds, and I was a dietitian then, and but did I say anything? No. I just kind of bit my tongue and tried to encourage her, very carefully, because as some of you have been pregnant, you can get a little moody when you can't sleep on your stomach and you don't sleep very well at night, that kind of thing. And so I really just kind of hands off, and I try to encourage her to eat good food and that kind of thing. But she ate some pretty strange stuff and gained 50 pounds, and that kind of. The second pregnancy, she only gained like 25 pounds or something like that. So first pregnancy, sometimes the hormone changes just makes you just eat. But anyway, so men, if your husband gets in this, or if your wife gets in this situation when you're pregnant, when you get married or whatever, just bite your tongue, because they're going to blame you for their condition if you say anything. So anyway, but here's the recommendations. A little bit more if you're underweight as opposed to overweight. But pregnancy is not a good time to go on a diet. It is because you need quality. Especially quality. Now, quantity maybe, but going on a diet, a strict diet where you're not getting the quality and the essential nutrients, is not a good idea. So very important that. So anyway, and then here's a guideline for that, but so you can look at that at your leisure. Excessive weight gain is a problem. If you exceed 35% of what they recommend, you can have some complications during your pregnancy. Pregnancy-induced hypertension, again, it could lead to preeclampsia, eclampsia, gestational diabetes. We've talked a little bit about that during the diabetic section. Increased urinary tract infections, prolonged labor, and I don't think any woman wants prolonged labor. And then possibly difficulty in doing a natural birth. So it'd be to your advantage to really focus on the quality of the food as opposed to the quantity. But I know it's hard. It's very difficult. And for one, having never been pregnant, I can't be the one to say, well, you shouldn't do that. It's stupid to do that. Yeah, that's not good. So anyway, I hope this helps you a little bit with understanding, especially if you're thinking about getting pregnant, or the idea would be eventually down the road you get pregnant. But I hope some of this will stick with you and you'll be able to have a very successful pregnancy. All right, so next time we will talk about once you give birth, where do we go from here nutritionally? All right, so we'll talk to you later.